Welcome everybody with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology and gastroenterology. Our topic today about one question. Can herpes lead to HIV? People living with herpes simplex virus are more likely to contract HIV. Similarly, people living with HIV are more likely to contract herpes simplex virus. But one does not cause the other. Is there connection between herpes and HIV and AIDS? There are risk factors preventing HIV or herpes simplex virus. So we will discuss all over prevention, medical attention. Also, we will discuss people living with herpes simplex virus are more likely to contract HIV. Similarly, people living with HIV are more likely to contract herpes simplex virus. We will say, but one does not cause the other. Herpes simplex virus is a virus that can cause ulcerative skin disease. Uh, Naturally restore your rhythm, hormones, and happiness. Lifeline. Herpes simplex can cause episodic outbreaks of blisters, open sores, or breaks in the skin, make it easier for other viruses to enter the body. Herpes can also alter the microbes of the vagina and anus, which make them less adept at fighting off foreign invaders and pathogens. Herpes HIV is a virus that attacks your immune system. This affects your body ability to defend against other illness. Both HIV and herpes simplex virus are sexually transmitted disease. Your risk of acquiring the other if you are exposed. Undiagnosed or untreated HIV can progress to AIDS, which is sometimes known as late stage HIV. Other causes and risk factors to consider: anything that increases your risk coming into contact with a sexually transmitted infection or disease will increase your risk of contracting herpes simplex virus or HIV. While herpes is primarily transmitted via skin to skin contact, HIV can be transmitted via body fluids. That means you can increase your risk of contracting HIV if you use or share needles, syringes, or other unsterilized drug equipment. These days, it is rare for an individual who tests positive for HIV to ever develop the AIDS. Modern HIV medicine is extraordinarily effective at managing the virus so that it does not become AIDS. As such, your risk of developing AIDS increases if you contract HIV and do not receive prompt medical treatment. Living with one condition and reducing your risk of developing the other. If you are living with herpes simplex, taking antiviral medications such as acyclovir, famiciclovir, and valacyclovir can help prevent or shorten outbreaks. There are also a number of home remedies and lifestyle changes that you can adapt that may help ease your symptoms and reduce your risk of outbreak. When your skin is free of lesions, you are less likely to contract HIV should you come into contact with it. Another option for reducing the risk of contracting HIV, whether you have herpes simplex or not, is to talk with your doctor about PrEP, pre-exposure prophylaxis. Pre-exposure prophylaxis or PrEP is a daily oral medication that helps reduce your risk of contracting HIV. If you are living with HIV antiretroviral therapy, this can make the virus undetectable and restore immune function. When HIV is undetectable, it cannot progress to AIDS. You are also less likely to contract herpes simplex virus or another illness when your immune system is restored. Reducing your risk of HIV and herpes simplex virus, the best thing you can do to reduce your risk of herpes simplex virus and HIV is to practice safer sex. Common safer sex practice include using condoms and other barrier methods during all sexual activity. Staying up to date on your sex transmitted infection status. Talking with potential or current partners about their sex transmitted infection status. Abstaining from sexual activity with people who are currently experiencing an outbreak or who are not adhering to treatment for an sex transmitted infection or sex transmitted disease. Discussing pre-exposure prophylaxis with healthcare professional and beginning preventive treatment. You can also reduce your risk of HIV by using sterile equipment to prepare or inject subcutaneous medications and intravenous substances. When to contact a doctor or get tested. If there are any chance that you have been exposed to HIV or another sexually transmitted conditions, contact a healthcare professional to get tested. This is particularly important if you develop any new or unusual symptoms associated with HIV, including rash, fever, chills, headache, fatigue, sore throat, night sweats, loss of appetite. If it has been less than 72 hours, means 3 days, since potential HIV exposure, talk with a healthcare professional immediately. They can prescribe post-exposure prophylaxis to help reduce the risk of infection. Post-exposure prophylaxis must be started within 3 days to be effective. Post-exposure prophylaxis medication are taken daily for 28 days. So we recommend testing for herpes simplex virus if you are experiencing genital lesion or sores, increased discharge, painful urination, and other genital symptoms could be sign of different sex transmitted infections. Thank you very much.